The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello, I am Kate Ball and I am the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. Now, I am always delighted to have you listening to our podcast, whether you're in the car, cleaning the house, relaxing with a cuppa, whatever you are doing. Our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm just going to Google that, please don't. Please listen to us instead. Now, we're in Series 5, and I am delighted that Dr Lillie Parker, an NHS paediatrician, has agreed to come back and talk to us. She joined us in Series 4 on some brilliant health-related subjects, and she's come back again. And today we're going to be talking about febrile seizures, a topic that we know at Mini First Aid can really frighten parents. Dr Lillie, thank you so much for joining us.
Thank you for having me. I'm really looking forward to this episode. This is a really important topic for parents.
Now, it's great to have you back. Always lovely to have a conversation, and especially because we will need to do some myth busting today around febrile seizures and educate parents on how they present, what they do, because febrile seizures can be quite scary, can't they?
Yeah, they're probably the most terrifying thing I think that can happen often at home. That to healthcare professionals, we often don't get that excited by them. But I also appreciate that for parents, when they witness these, they're really scary. And parents often come into hospital after a febrile convulsion completely traumatized by what they've seen. And so I'd really like to kind of myth bust, like you say, give people a bit of information about how they happen, why they happen, and make people hopefully feel just a little bit calmer that if this happens, it's not the end of the world, and you know what to do if it is happening, because the panic often sets in when these things happen at home.
Now, there could be people listening today that go, I don't want to sound silly, but I don't even know what these words mean. I am listening, I'm keen to know, but I don't know what it means. So let's go right from the absolute basics. Just from the beginning, what's the simple terminology? What are we talking about here today when we talk about febrile seizures?
Sure. I think there's a number of terms that can be used for the same thing, and that's important. So some people call them febrile seizures, some people call them febrile convulsions, even febrile or fits. In essence, they're all different terms for the same thing. I think it can be confusing because the word seizure makes people automatically often think of epilepsy. Mm-hmm. And actually, epilepsy is a condition characterized by a kind of abnormality in electrical activity of the brain. And we're not talking about epilepsy when we're talking about febrile seizures. We're talking about seizures that are caused by fever or temperature, which is a body temperature of above 38 degrees in children. And they lead to a very temporary disturbance in the electrical activity in the brain, but it's caused by the temperature rather than an underlying structural or kind of genetic abnormality in how the electrical activity in the brain works.
Okay.
But they look very similar to a epileptic fit or seizure, and therefore they're quite scary to witness. And the word convulsion, so if you call it a febrile convulsion, that actually relates to the body rhythmically jerking or moving. So that's the abnormal movements that you see. Seizure is a more generic term for this kind of abnormality and electricity happening in the brain. But yeah, there's lots of different words, and lots of people just haven't heard of them, because if you haven't seen one or your child hasn't had one and you're not medical, you may never have witnessed this. they're surprisingly common, but if you haven't seen one, you wouldn't necessarily know. And so many parents say to me when they first come in with them, I've never heard of this. I've never seen this happen. I didn't even know this was a thing that could happen. But actually, they are surprisingly common.
We get that at our mini first aid classes, where it's a topic that we cover, and we have parents that sit there and go, I've never heard about this before. So this conversation is going to be really interesting. Now, you said the words surprisingly common. Have you got some stats on the ages? When does this happen? What age group are we talking about, and how common is it? What's the likelihood of this happening to our babies or children?
So around 1 in 20 children will have a febrile convulsion at some point in their life, so about 5%. So if you looked at a primary school class, probably one child in the class would have had one, which isn't a huge amount, but is enough that actually there is always a risk of this. And I think, as we've talked about and we'll continue to talk about, because they look quite frightening, I think it's really helpful to know that this is a possibility and be prepared for what would happen if it did happen to you. And typically they happen in younger children, so between the ages of about 6 months and 6 years, although that's not a definitive, they can never happen outside of this age. But yeah, typically it's the kind of preschool up to the first year of school type age children who have them.
Okay. And when we talk about causes and we think about what's going to make this happen, what is it that's going to cause a febrile seizure to take place?
So the simple answer is a fever. A fever is what causes this to take place. What we're not 100% sure on in terms of the evidence yet is what it is about the fever that means that some children will have these in some way. And we don't know yet if it is specifically how high the temperature is or how quick the body changes temperature, which causes them. There's some evidence for both of those. So there's some evidence to suggest that if the temperature changes really quickly, they're more likely, but there's also some evidence to suggest the higher the fever, the more likely they are to get it. But actually, often a febrile convulsion can even be the first sign of an illness. Okay. So your child might have just been fine, and then in the night, or it's often in the evening and the night, their temperature changes and these things just happen out of the blue. Some children, it will be that they've been unwell with something for a few days. They've been having ongoing temperatures and then this happens. But actually, I see a lot of families who this is one of the first signs that their child is becoming unwell. Okay. And again, that can be quite scary because it comes almost out of the blue.
While we're on temperature, just to be absolutely clear, we are talking about body temperature as opposed to ambient room temperature or a sudden spike in the weather. You're not going to... Okay.
So we're talking about a body temperature above 38, which is classified as a fever. I would say the majority of ones we see, they're a bit hotter than that, probably 39, 40. But just because it's a low-grade temperature does not exclude them from having a febrile convulsion. So I've definitely seen children who have had febrile seizures with a temperature of 38.2, 38.5, which as a health professional, I wouldn't classify as particularly high fever. But yeah, we're talking about body temperature, and we're talking about children who are unwell with viruses, with bacterial infections that are fighting things, and that's why they're having fevers.
And their temperature has gone up because their body is fighting something that's going on. So we would talk about investigating that when we get to hospital, but let's sort of talk about what happens. So this seizure is taking place, or is it? What's your signs and your symptoms? What we as a parent or carer, we talked about it being very scary. What happens? What will you see happening?
Yeah. So as I said, quite often children will be in the early stages of their illness when they develop febrile convulsions. They can even be the first sign that your child is unwell. But unanimously, the way we diagnose them is by knowing whether they've had a fever at the time of this fit or convulsion or seizure. And I think the things that you will see, so the seizures can be quite varied. Some children, they'll look quite different, child to child. But generically, the thing that makes it a seizure is that they're unresponsive to you when this happens. So they will have a period where they are unresponsive. They may have their eyes open, they may have their eyes closed, but they won't respond to you if you stimulate them and try and wake them up. And they may go stiff, they may jerk their limbs, They may have some abnormal eye movements where they roll their eyes back or flick their eyes from side to side. But unlike a rigor, which is something where they basically shiver with a fever, so a rigor is a shivering with a temperature, which lots of children will do. During a rigor, their eyes will be open, they'll still be responding to you. Whereas during a febrile convulsion or seizure, they won't respond to you. And that's often the thing that scares parents the most, is the unresponsiveness, understandably, because they can't get their child any feedback from their child at that time. And they can last anything from a few seconds all the way up to a few minutes, or later we'll touch on atypical febrile convulsions, but they can last a really long time. But the typical febrile convulsion will last a matter of seconds or minutes, and they will stop on their own the majority of the time. Which I think is really an important thing, because parents will panic and think, when's this going to end? And actually, to us, a minute sounds like, a minute, that's not very long. But a minute when your child is having a seizure feels like an eternity. And so in A&E, when I say, how long did it last? They say, oh, maybe a minute. But honestly, that minute felt like forever. And I say, I know.
Of course,
it feels like forever. But those are the kind of signs that they will have. And in order for it to be a febrile convulsion, at the time when they have that seizure, they have to have a temperature above 38 degrees. Not that that's necessarily going to be the first thing you do, because we'll talk about what you do, but it is important to know whether they've had a temperature either directly before or directly after this has happened.
Okay. So when we talk about what you should do, so this happens to your baby or your young child, and we talk about this in our classes, we talk about treat, but let's just, for benefit of people listening now, what should we be thinking about, or what should we put into place when a febrile seizure happens?
So I think the first thing is to make sure they are in a safe place and they're not going to injure themselves from something else. Often they will be in bed, or they will be in your arms or on the sofa, and that's okay. But I think removing any toys or anything from around them, trying to make sure they're lying on a flat surface which they can't fall off, be that the floor, be that your bed, but in the middle of the bed so they're not on the edge and going to roll away. And if you can, putting them on their side. I mean, I'm sure if it's an older child, you would try putting them maybe in the recovery position, but especially in little toddlers, that's quite difficult. But aim for them to be on their side rather than on their back, because it's easier for them to clear any secretions and breathe if they're on their side. And then I think the first thing you would do is call for help if you're on your own. So if there is someone else in the house with you, if you are a 2-parent household, or you have an older child who is old enough to be able to help, then calling for some help is great. If you're on your own, obviously you're going to manage it on your own. The other things that I really recommend is either starting a timer, or even better, pressing record on your phone camera, because not only will that time the seizure, but it also, if you can record what's happening, then you can show that to a health professional later. And
that's such a good idea.
Is really helpful for us to see that, because we do see a lot of children with seizures. We know pretty quickly whether that's kind of a normal febrile convulsion or not. But often people forget, obviously, in the heat of the moment to do that, and that's understandable. But I would say it's really helpful if you can. And call for help. So outside of the house, you may want to dial 999. You may want to get a call. It doesn't necessarily mean that you have to go to hospital, but the majority of people who call an ambulance will end up coming to A&E to get your child checked out, even if the febrile seizure settles down. And that's absolutely fine. We can, again, touch on that a bit later. But I think often knowing you've got paramedics on the way to you, especially if they haven't stopped seizing by the time you get to your phone and you've made that call, knowing that you've got help on the way is important for parents.
Is it a 999 call for a febrile seizure?
So not always. It depends, really. If it's the first febrile convulsion that they've ever had, and it takes you a minute or so to get your phone and get or call for help from someone else. If they are still fitting at kind of a couple of minutes, I think a 999 call is completely valid and fair. We usually say if they terminate within 3 minutes on their own, as in they don't need any medicines or anything to stop them from seizing, and they come back round to normal, then that's relatively reassuring. But most paramedics will bring, especially the under 2s, they will bring them for a checkup anyway. And we do want to see every child who has a first febrile seizure. Some children will, however, go on to have more after they've had one. And I think the statistics are about a third of children who have one will go on to have more.
On other occasions?
On other occasions.
Right, okay,
So
okay.
If they have one, they may end up having more. It's not, as I said, it's only a third. But if your child is a child who does end up having lots of these, you may get to a point where, because you've seen them before and you know what they look like, and you know that they've got a cough and a cold and they've had a bit of a temperature or something through the day, you almost are anticipating it and you start to feel not relaxed, but more reassured that you know how this is going to go. And if that's the case, you don't have to call an ambulance. You can manage it at home, but as I said, it needs to stop on its own within a couple of minutes, so 3 minutes maximum. It needs to definitely be associated with a temperature. So you need to know that they have a fever above 38, and they need to be back to their normal self relatively quickly. So within kind of 10 to 15 minutes.
Yeah, okay.
And if you meet all those things and you've seen these before and this is what your child does, then you can keep them at home. That's fine. We don't expect to see them every time, but we definitely know that the first time it happens, or if there's any features of atypical seizures, then bringing them to hospital afterwards, or calling a 999 if you feel that you need that support from paramedics is completely fair.
So we will get back towards the end, because I'll talk to you about if it's not related to temperature, because I think that would be quite a good differentiator for parents. But just whilst we're on temperature at the moment, is it therefore quite helpful for people to have an ability to take a child's temperature at home, so a thermometer of some description? Yeah, okay.
Yeah,
so that's
an underarm one is often the most reliable.
Okay.
So there's a whole host of different thermometers on the market. In the under ones especially, we only use underarm ones in hospitals. In the over ones, and that's because their ear canals are pretty small, and if you use the inner ear ones, they're not that reliable. As they get bigger, you can use the inner ear ones. They're okay, and underarm also really good. We don't really recommend the forehead pointy ones or the sticky, kind of bits of film that you put on their forehead and it tells you how hot they are. But actually the cheapest ones are often the underarm ones.
Yeah.
They're like £5 from a pharmacy, and they will do the job in the moment.
Yeah. We have a small digital thermometer that comes in our family first aid kits for that very reason, because it needs to be one that you can place under the arm so that you can give an accurate reading. We sometimes say in classes that just keeping a note in your phone or taking a photograph of the thermometer, because then you've got the timestamp, because then you can see when helpful. When somebody's because particularly if the temperature's doing ups and downs and all sorts of things. So let's therefore assume that we are going to A&E. So we're going to hospital.
Sure.
Talk to me about what happens when a patient gets to hospital having had a febrile seizure. What's going to happen next?
So it depends a little bit on what your child looks like at that point. To be honest, the majority of children, by the time they have been assessed by, say, a paramedic who's come out to your house, they've maybe had a dose of Calpol, they have had their temperature checked, and then they've driven to an A&E department that is between 15 and 30 minutes away from your house, they will look remarkably a lot better by the time they get to A&E. And parents are often like, the scariest thing is that just happened to me in my life. It was terrifying. And now my child is playing in the playroom, watching TV, swiping on the iPad, whatever it is. That's fine. We will still assess them. We will make an assessment. So we will do some baseline observations. They will be seen by a doctor. They will be examined. We will take a history of what's happened at the time when they've had the seizure. And again, that's when the video is really helpful for us, if we can see what actually happened at the time. And our aim really is to try and find out where the temperature is coming from. So be able to make a diagnosis. The majority of febrile seizures are caused by viral infections. So simple as a cough and a cold, really, in the majority of children. But we'll want to rule out things like urinary tract infections, UTIs, diarrhea and vomiting sometimes can cause this. We definitely want to rule out other causes for seizures, and I think we'll touch on those later, but there are some simple things that we can do to try and rule out other causes, things like a blood sugar. And depending on how worried we are from the history that we've got, that might be all that we do. We may just look at them, examine them, do some observations, give them some paracetamol, ibuprofen, and then we might be sending you home with some information about febrile seizures. Obviously, if we find concerns about more serious infections, we may treat that with antibiotics. We may end up doing more tests like blood tests, urine dips, even chest x-rays. But actually that is a small proportion of the children that we see.
Okay.
The majority of them don't need that. And if they have an atypical febrile convulsion, which is basically a convulsion that lasts a really long time, doesn't stop on its own, requires medication from maybe the paramedics to stop it, or looks very unusual compared to what we would normally see, then we may be inclined to do some more further tests, because those atypical febrile seizures come with a slightly higher risk of being some of the other causes of seizures. So in that case, your child might get antibiotics. They might end up staying in hospital for a few days. They might have a scan of their head. And those can be really scary. I've seen a couple of those that those are really, really scary for parents, those atypical ones, but they are quite rare.
Yeah. So I think it would be fair to say that you need to be fairly open-minded to the fact that you might have to have some tests when you get to hospital of some description. Let's talk about those other causes then, because it's always a tricky one with a podcast, because we want to make sure that we are the clarity, and that sometimes if people go to Google and put in certain symptoms, it can tell them all sorts of awful things that, could be happening to them, and actually it's not. It could be something that's a very natural reaction. However, I think it's really important to say that actually there might be another reason for a convulsion or a seizure taking place. Do you want to talk to us a little bit about that?
Sure. So as we talked about at the beginning, epilepsy is another reason why children may have seizures, and majority of the time they are when you don't have a fever. But occasionally children who were always going to develop epilepsy will start by having convulsions when they have a temperature, and then will go on to have convulsions when they don't have a temperature. And that's because that fever reduces the threshold for having a seizure. So actually, if you were going to always develop epilepsy, you might find that as a child, when you have a fever, that's when you have your first ever convulsion. But only around 2% of children who have a febrile convulsion will go on to develop non-febrile seizures.
Yeah.
So it's like 1 in 50 who have a convulsion will end up having an underlying structural or electrical abnormality that means that they end up having epileptic seizures later in life. So any abnormality in the structure or electrical activity of the brain can cause seizures, and that's often something you're born with or are genetically always going to develop. So epilepsy is a big worry, and that can come on at any point in childhood or in your teenage years or even in adulthood. But there are other things that can also cause seizures. So extremely low blood sugars can cause seizures, and that's blood sugar is often one of the first things that the paramedics will do when they come out to your child, because, for instance, say your child has had diarrhea and vomiting for a few days.
Yep.
And they have a bit of a temperature. Now that temperature may have caused a febrile convulsion, but also if they haven't eaten or drunk anything and they've dropped their blood sugar dangerously low, that low blood sugar can also cause a seizure. And so they may need treatment with some sugar gel or some fluids in hospital, etc., to get their sugar levels up. The other things, the more worrying things, the things that will come up on Google as the red flags that you're talking about are things like serious brain infections, so meningitis, encephalitis, brain injury, so bleeding around the brain, or tumours in the brain itself. All of those can cause electrical abnormalities.
Yeah.
Those things are really rare. But if your child had, for instance, an atypical febrile convulsion where they seized for 20 minutes or they needed more medication to stop it, those are the things that we would just be doing more tests to look for. So we would do blood tests to look for infection markers. We may scan their head to look at the brain inside and make sure it looks structurally normal. There's no masses, there's no bleeding, there's nothing else that could have been causing that. But we are talking about super rare.
Yeah. It's tricky, isn't it? Because you've got to sort of, as a parent or a carer, you've got to different, the panic is that this is bigger, much bigger. And then, in the majority of cases, the febrile seizure is a reaction to temperature. So I guess that key thing, knowing temperature, is really important, because that's going to be one of your key indicators right at the very beginning, and also that length of seizure. So being able to time it and articulate to the medical professionals how long the seizure has taken.
Yeah.
Just going back then to the febrile seizures, is there, people might say, well, how do I know if it's going to happen to my child? How do I know? Or is there anything I can do to prevent it happening to my child? How do you get picked out that this is going to happen to you?
So you don't, and that's the hard thing, and that's the scary thing, is that actually we say 1 in 20 children will have one, and so far we don't have very much evidence as to how we can differentiate which one of the 20 that's going to be. If you lined up 20 nursery kids, which one's going to have a febrile seizure? And that's really hard. And I think the other thing, and this is something that even I as a healthcare professional really struggle to get my head around, but the evidence is that treating fever with paracetamol and ibuprofen, even regularly, does not prevent a child having a febrile seizure.
Oh, wow.
Which is really hard to wrap your head around, because even I'm like, but surely if you're treating it and they don't have a temperature, they're not going to have a seizure. But they did a really large study where they looked at children who had a febrile convulsion, and for some children they then gave paracetamol and ibuprofen regularly, and for the other children they just got a placebo. So that just means like a fake drug that was completely nothing. And there was no difference in the children who went on to have another seizure during that episode or had more febrile convulsions. It made no difference. And I think anecdotally, perhaps that's because actually it can be one of the first signs, like I said, so the temperature can change very rapidly and you haven't necessarily had a chance to treat it. But the evidence is that these drugs don't make a difference. And I think that's such an important point, because I see online so much when I'm doing posts about febrile convulsions or about temperature, parents say, I have to treat the temperature to stop them from having a seizure.
Okay.
And there's a lot of negativity to parents who maybe say, I don't always treat fever in my child, because the guidance from NICE, from the NHS, is that you don't have to treat temperature in your child if they otherwise look quite well. You don't have to treat the number, you treat the child. So if the child looks sick and in pain, then treat it with Calpol, ibuprofen, Nurofen. But if they look quite well and they've got a temperature of 39, you don't have to give them medication to bring that fever down. That fever is part of the process of killing the infection that they've got underlying, and actually can be quite helpful to shorten their illness. But a lot of parents will then say, you're putting them at risk of having a febrile convulsion if you don't treat it. But the evidence does not support that. It's just not true.
Gosh,
the studies that we have. So and that's really hard for parents as well, because there is basically nothing you can do to prevent this from happening. What you can do is know what to do if and when it does happen.
Yeah.
And I don't criticize any parent who says, oh, they've had a febrile convulsion before, therefore every time they get a temperature I get really nervous and I make sure that I'm giving regular paracetamol and ibuprofen because I don't want them to spike. I'd never say like, you're wrong, that's the wrong thing to do. But what I would say is it's probably not going to make any difference, and don't feel like you have to. And if you miss a dose of Calpol, that was the reason that they had the fever, because you'll beat yourself up about it. But actually, the evidence doesn't support that.
But you can still give Calpol. You're not saying don't give it. It's just that you're treating the child as opposed to having to do it as a prevention.
And that's what I always say is, you should always treat the child in front of you. If they look like they're in pain, if they're miserable, if you're trying to make them feel better in themselves, then give it. But you don't have to medicate them every single time they spike a temperature if they look otherwise well, because as I said, that temperature is like the body's response to the virus or bacteria that they have. And by running your body hot, you are killing off that virus. And obviously we survived for thousands of years before we had these medications. And so there was a reason why we developed fever. It isn't always a bad thing. But I wouldn't want you to allow your children to be in pain or look horrible with a temperature because they said, oh, Dr. Lillie said not to give it. That's not what I'm saying. What I'm saying is you don't have to give it every time. And it's not going to make a difference to whether or not your child's going to have a febrile convulsion.
So if they do have a febrile convulsion, it's knowing what to do. So it's knowing what to do and making sure that, particularly in their first instance, is that you seek medical advice. And then there's that piece around the prolonged, so those atypical seizures where it lasts longer than your 3 minutes. Lils, this is brilliant. This has been really, really helpful because we've been, there are all sorts of, as you said, there's lots of myths and there's lots of things that do the rounds on social media and online that can have parents really concerned and worried. But it is something that, because of the chance that this may take place in your child, that people do need to know. On that, if you had anyone thinking, right, what's my key takeaway from today? It's always a piece that we do on this podcast. What would you want people to take away as the one key thing for people to remember from learning about febrile seizures or febrile convulsions?
I think it's firstly knowing that they exist, that this is a thing that can happen, and this is a thing that is relatively common in terms of childhood illness. Don't panic. That's the first thing. It's so hard. It's so easy for me to say that, isn't it? But it's so hard not to in the moment to panic. But actually, if you can just try and take a deep breath, keep a cool head, and think of those things that we talked about to do in those first few minutes. So putting them somewhere safe, putting the camera on record or the timer on, calling for help if it's lasting more than a couple of minutes, then you know that help is on the way, and you know that if it's lasting that bit longer or they're not coming back round to normal, you've got that medical expertise coming, but you've done all the right things in that moment. And you can try and cool them down, but actually the seizure is going to last however long the seizure is going to last for. You can't give a child Calpol whilst they're having a seizure, and you can strip off their clothes a little bit. But again, we don't recommend like dunking them in cold water or anything like that. You know, your job is to support them through that seizure in the moment and get them to someone who does know what to do if it doesn't stop, and know when to call for that help. And hopefully you won't be a parent who does have these really frequently, but if you do, then you do become more confident in knowing how to manage them and what they look like. And actually parents who end up having a child who has 10 of these in their childhood, they become quite relaxed about them at the end, because they're like, I've seen this, I know what this looks like, and I know it's going to be fine at the end. But that first one is scary. Try and don't panic.
Thank you. I hope that by hearing your wise words today, that it's put some minds at rest. And you can listen back to this podcast at any point. So perhaps if it happens and you go on to experience it, you can come back and you can reflect and learn from Dr. Lillie's advice. But Lillie, thank you so much for all the important information that you've shared with us today. Lillie's a regular guest on the Mini First Aid Family Health podcast. We love her really helpful advice. And we will share some key links with you in the notes for today's podcast, where you can go and get some more information should you need it. Now, if you've enjoyed listening to today's podcast, please subscribe on your regular podcast channel. We'd love to send you a podcast every week through our podcast series, and we cover all sorts of family health issues. And if the family health subject that you want to know about has not been covered by us yet, please do send us a message. We have wonderful guests like Dr. Lillie who come and share fantastic information with us to dispel those myths, which is what we've done today. So please do send us a message or a note if you want a family health topic covered. So thank you so much for listening today. You've been listening to the Family Health Podcast. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.